Hi, this is Mike Nylans and Michelle Major. Both of us work in the operating room at Nationwide Children's Hospital. We were interested to see if there was a link between acupuncture and the incidence of postoperative nausea and vomiting. Our PICO question was, in surgery patients, how do acupuncture methods compared to conventional treatments affect postoperative nausea and vomiting in the 36-hour postoperative period? Postoperative control of nausea and vomiting, or PONV, can be difficult to manage for patients who have had surgery. It is critical to mitigate nausea and vomiting postoperatively to avoid aspiration and the severe complications that come with it, which can include the patient's death. The inclusion of acupuncture methods in the management of PONV appears to significantly decrease the incidence of nausea and vomiting postoperatively in both adult patients and pediatric patients. The aim of this project is to examine how, after the initial 36 hours post-operation, acupuncture affects the rate of PONV compared to the use of conventional medications alone. A total of 10 studies and 2 systematic reviews were identified through CINAHL and PubMed. The findings of the 2 systematic reviews and the quantitative studies show that the inclusion of acupuncture significantly reduces the occurrence of PONV compared to the use of conventional treatments. The evidence shows that acupuncture can be very effective complementary or standalone treatment in the management of postoperative nausea and/or vomiting. Acupuncture is a non-pharmaceutical treatment which can be used alone or as an adjunct to antiemetics to control PONV. It is an integrative and holistic approach to postoperative control of nausea and vomiting. Specifically, acupuncture needles and pressure beads stimulate nerve endings at acupoints, predominantly P6 or ST36, which release the body's natural chemicals to help prevent nausea, which leads to vomiting. Who can use it? Acupuncture can be applied to any patient, both adults and children. There's early documentation of acupuncture being practiced as far back as about 100 BCE. Initially, acupuncture was practiced as an ancient form of Chinese medicine. They used sharpened bones and stones to prick the skin to alleviate pain to treat various physical, emotional, and mental conditions. This practice is based on the existence of meridians in the body, where specific points are pricked with needles, restoring energy flow and balance. We believe that training, licensure, and credentialing of PACU nurses will be essential to providing consistent results. The setting will be in the post-anesthesia care unit, or PACU. Patients will need to sign informed consent, as this therapy, just as all others, is voluntary. Acupuncture or acupressure will be offered to adult and pediatric patients as treatment or as an adjunct to antiemetics for PONV management 36 hours after surgery. Our information came from the CINAHL and PubMed, where the search terms we used were postoperative nausea, vomiting, surgery, acupuncture, complementary, and alternative medicine. This search returned 12 studies which were worthy of review and appraisal.
The evidence supported the application of acupuncture and acupressure for post-op nausea and vomiting management and came exclusively from experimental quantitative studies, including 10 randomized controlled trials and 2 systematic meta-analysis of randomized controlled trials. In conclusion, evidence-based results demonstrated significant effectiveness of acupuncture and acupuncture-related techniques in treating postoperative nausea and vomiting. A majority of the experimental studies investigated the application of acupuncture or acupressure along with related adjunct therapies such as electroacupuncture or acupoint electrical stimulation for managing acute PONV. Acupuncture methods were shown to greatly complement the effects of traditional antiemetic therapy. Based on the results of our research, we recommend additional studies to investigate the safety of acupuncture methods for the control of postoperative nausea and vomiting in order to achieve the greatest benefit and to minimize side effects while practicing this technique. We noted that the definitions of acupuncture and acupressure in the studies are not standardized. The definitions are either too broad, including multiple types of acupuncture point stimulation, such as acupressure, and transcutaneous electrical acupoint stimulation, or they were too narrow, only focusing on wrist acupuncture. A more precise definition of this technique will be required for further studies. We hope that our research helped give you a better understanding of acupuncture therapy and its application to control post-operative nausea and vomiting.